Hello, everyone. Welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Mayur Davda, a man behind the dental photography, a person who has if who has his name when talked about dental photography everywhere in each part of India. He is not only having his own practice in Bombay, is also a founder of dental photography school as well as 32-minute podcast. He is an artist, an author, a photography enthusiast, what not. He has so many things in his bag. He's a multi-talented person, things that actually I cannot mention. He's a national international speaker in different in different conferences, in different colleges. He has so many students who he has mentored to, and so he's here to help us understand what he has done, understanding his journey, how did he end up into pursuing dental photography, and also understanding the small in-depth about the photography in dentistry. So welcome, doctor, to the platform. It's really nice to have you here.
It's my pleasure, Ayushi. It's nice to see that young dentists like you are growing so well, even in these difficult times. And it's really important to connect with each and every dentist, not only for others but for your own self growth as well. Because when you're speaking to the biggest names in dentistry and even other fields, like you said that you speak to other medical professionals as well, I believe that there's so much to learn from everyone, and learning is a never-ending process. So I'm really happy to be on your show,
Thank you.
and I'm hoping that people can learn something out of our talk today.
Definitely, sir. You are an inspiration to so many. I'm sure, this will be people will definitely learn so much. So
Great.
let's understand, photography in dentistry, something very different. People, when you started, people didn't think about it, doing is a separate thing. So was photography your passion? How did it come to you?
Uh, yeah. So, very honestly, dental photography was absolutely something that I was not looking forward to when I graduated. I did not even know shit about it, very honestly. Um, so I actually started with wildlife photography. I love taking pictures of butterflies, nature, wildlife, and that's how everybody's journey is going to begin. I'm not really sure. Okay, my journey did actually start with thinking that maybe photography is going to improve my work, and that was the boost mainly. But dental photography does get boring after quite some time because it's quite monotonous and you keep on taking pictures of the teeth.
Hmm.
So yeah, I diversified into various different genres of photography.
Hmm.
I started off with wildlife. So very small things, like I started taking pictures of sunsets, landscapes, flowers, butterflies, and then I gradually matured to more um, humble wildlife photographer. Um, when I say I graduated, means initially when you actually start taking pictures is mostly for likes on Facebook and Instagram and
Hmm.
other social media, and very honestly that's not how it's supposed to be.
Hmm.
You become a conditioned wildlife photographer by understanding the wildlife, being one with nature, trying to understand animal behavior, trying to understand bird behavior. And it's like, you start aging with wildlife, and then you start taking great pictures because you're understanding nature much more better.
Hmm.
Then you actually start getting better pictures and you actually end up enjoying it even more, very honestly.
Hmm.
Otherwise it's just pointless to, I mean, I feel it's really pointless to take pictures of wildlife
Hmm.
just for the sake of likes. That's a little controversial for me. Then later on I realized, after doing butterflies, I actually did a lot of butterfly life cycle pictures, photographs as well. I started recording their full cycle right from the egg. I'm sure everybody knows what a life cycle of a butterfly is. Egg, you shoot the larva, then the pupa, and then the ultimate butterfly. So I
mm,
used to love doing that. That increased my interest in plants as well, because butterflies have their very specific food plants or even host plants,
mm,
because they lay an egg only on that particular plant. They'll not lay an egg on any other plant, and that's so amazing. So it kind of increased my interest in wildlife and nature, and I thought that I need to understand nature more. So what I did was I actually joined a workshop of 1 year workshop, 1 year course
mm,
on birding, because I loved birds even when I was shooting butterflies.
mm,
And then I went ahead and did one course with BNHS. People who are from Bombay, you might know what BNHS is. It's Bombay Natural History Society.
mm,
So I did 1 year course on ornithology, where we learned a lot about birds, how to count their feathers. We actually used to net the birds, hold them in our hands, weigh them, study them. Uh,
mm,
we used to guess what is the age of the bird, and then we also used to ring the bird on their leg. The ring is actually for understanding the migratory pattern. So I really went deep into wildlife and birds, and then in order to understand it even better, I did 1 year course on botany.
okay.
And then I realized somewhere down the line, when you are shooting pictures, it does go unethical at some point or the other. When you see awesome pictures on social media, you might have to answer this question. You think that this picture would have been possible ethically? For example, there might be a lot of kingfisher. I'm sure everybody knows what a kingfisher is. It's one of the most beautiful birds out there.
Correct.
It's really easy to bait a kingfisher with the help of a fish. So if you want a good picture of a kingfisher, you can bait it by giving it a fish.
Mm,
And a lot of photographers
do that.
do a lot of unethical things in wildlife. Some of them even give out a bird call,
Okay.
like they have their bird call recorded on the phone, and when they go into the field, they'll play it, and the bird gets very inquisitive because it wants to know who has come into their territory, right? Nobody would want an encroachment. So in order to find who's come into their territory, they actually go ahead and come to see who's hanging around in my area.
Mm,
So that's how people record birds many a times. I'm not saying all of them are like that, but many a times the rare birds are getting pictured like that. Then
mm,
I realized that uh, wildlife photography was not really for me, because I really believe in ethics quite strongly,
correct.
and I obviously do not want to end up disturbing nature.
Yeah.
Because when you start loving nature, you actually don't want to trouble it so much. That's the basic point of not littering when you go for a trek, right? And
Correct.
you start helping the nature. So I left wildlife photography completely, although I had a good amount of publications in international magazines like Lonely Planet. I'm sure everybody would be knowing that. And then I started pursuing something that's not so encroaching to the nature, and I started taking pictures of splashes. That's what I specialize in. I
Problem.
take pictures of water drops and splashes, and that's my specialty. um, and the best part about the best part about splash photography is that it's very difficult and it's very rare to see.
Mm,
Why it is very rare? It's because imagine what I do. I take a bowl of water in a dark room. It's a pitch dark room, very dark, and I can't see anything, but I drop a drop of water. It's going to splash and a jet comes out of it.
mm,
When the jet reaches a maximum height, I put another drop. So there's a collision between the jet going up and the drop coming down.
mm,
And at one particular point, they kind of hit each other and there's a big splash. So I actually shoot that particular moment.
mm,
And that's almost like giving a goosebump. If people are really into photography, they might have got a goosebump right now. So
mm,
I specialize in taking pictures of that particular moment. And I love doing that. But the only problem with that is it's going to take weeks or even days to take a good picture, right? Because there'll be a lot of missed images because it's high speed photography.
mm. Yes. Yes.
So yeah, I started doing that, and then I realized that since I have graduated to such a good level of photography,
Mm,
I think I can be very helpful to my colleagues
okay.
and teaching dentists. So that's how I landed up in teaching dental photography, because I knew that I might have reached the zenith of photography. And then I realized that, okay, I think I can easily teach my colleagues now.
Correct.
That's how dental photography school came into picture in 2013.
Hmm.
and there was no looking back. Although it took me a very long time to convince people that dental photography is important, clinical photography is important, and most of my energy would go into encouraging people to take up dental photography rather than actually teaching dental photography,
Correct.
which obviously is going to happen to any new field which is budding up, right? Anybody who's going to come up in life and who's the pioneer is
Yes.
going to face a lot of obstacles because
Correct.
he's the first and he has to clear everybody's mind to pick to and convince them to take it up, right? That's what I did, and I still do that because the young dentists are coming from college. They don't know anything about dental photography.
Yes.
So my journey of encouraging everyone to take up dental photography and clinical photography continues, but I have grown to a very good level. I can say that I've authored in a couple of textbooks in dentistry, and I have recently also written a chapter in a textbook in dermatology by Dr. Paula Pascual.
Nice.
She's a dermatologist in Spain, Barcelona. I'm very, very proud that I could get my name and a country's name in a dermatology textbook. And it just goes on to say that every field in medicine is closely related to each other. Nobody's on a higher level, nobody's at a lower level. And uh, I personally think that dental photography is one of the most difficult forms of
Exactly.
photography.
See, everything has its own space, and I completely agree with you on that.
Hmm.
So yes, understanding about photography, definitely it was so nice to understand your journey into photography now. So when you tell about dental photography, what are the kind of applications that you think in dental photography? We understand documenting is definitely one part, but apart from that documenting, how do you help these students to understand why is it so important, for you to learn dental photography?
All right. So before I answer that question, I think my video is looking very dimly lit. So I'm just going to increase the light on my face. Can you give me a moment for that?
Yes, sure, sure.
Yeah. 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 So to answer your question, very honestly, there are more than 50 applications of photography in dentistry, and that might be a little overwhelming for a lot of listeners. And I believe that photography could have so many applications. And this is why I actually tell all the students to pursue photography immediately
Hmm.
as soon as they enter into dentistry.
Mhm.
Um, I believe that a person who's joined first year BDS should start learning photography immediately because by the time you actually start doing photography clinically, that's from third year onwards, right? When you
Hmm.
actually counter a patient, you
Yes.
should be well versed with how photography has to be done. So you do preclinical work, right, before you actually start clinics. This is the same way that you have to pursue photography as well. So why do you have to pursue photography so early on in your life? It's because this particular branch has more than 50 applications in dentistry. It's going to affect any other branch of dentistry. To name a few uses of dental photography, it's used for medical legal cases. If somebody is going to screwing up with a dentist, you need to have proof, right? So medical legal is one, publications is one. So I've had various national and international publications today, and that's thanks to the pictures that I've shot somewhere or the other. It could be clinical cases or even dental photography per se, but you can publish your cases or even something that's different from normal. For example, if you've taken a picture of, say, um, something that different from normal, like a talent's cusp, and the picture is nice. Maybe if you put it on social media and somebody who's coming up with an oral pathology textbook or a DADS textbook might want it from you, so, and you can get published. So if you want to get immortal, it's a great way to get immortal because you'll get published. And to publish, it's very easy to take good pictures rather than writing a lot of words, right? And nowadays the youngsters do not like to write a lot.
Hmm.
That's what I believe, because everybody's gone more onto the video and audio platform. Nobody likes to read a book.
Yes, yes.
And yeah, so coming back to the question,
Hmm.
dental photography is useful for educating.
Hmm.
If you record a procedure, you're actually trying to educate yourself, and when you share it, you're educating others as well.
Hmm.
Like there could be dental training videos, there could be dental training blogs or photographs which could have photographs, and
Hmm.
it's going to be helpful for others. Coming to clinical dentistry, it's useful for various things like shade communication when you're doing prosthodontic work. and to share with your colleagues. When I'm not understanding or I'm stuck at a particular stage, I take a picture, I send it across to my colleague and ask, oh, bhai main idhar fas gaya, what do I do now?
Correct.
I'm not able to come out of it. So looking at that particular image, he's going to be helping you very quickly rather than trying to explaining it in words, right? It could be so difficult to explain in words. So that actually, it becomes very easy to communicate with your colleagues.
Hmm.
Then publications was the main, lab communication is more. Then obviously, if you talk about patients, uh, I'll give you an example. When a patient comes to me,
Hmm.
instead of telling that after the root canal, I would probably not want to give you a crown,
Hmm.
because when I do a tooth prep, I'm going to be removing all the enamel.
Yes.
Instead of doing that, if I just show them what is an inlay or an onlay,
Hmm.
I can show them that I'm going to be preserving a lot of tooth structure. So for me, I think if you want to grow as a dentist, it becomes very important to educate your patients, because if you want to encourage them to go for the right kind of treatment,
Hmm.
you have to show them pictures.
Correct.
And even to convince, if you have a diastema closure, for example, how is the patient going to trust you? He's going to trust you if he has seen your cases, right? That's the easiest way to convince someone. Or tooth whitening also. So if you show them their previous cases, they're going to be very, very happy, and they're going to be trust you. They're going to be trusting you more. You should also take pictures and send it across to your patients immediately. In that way, you're going to be building transparency between your patients and yourself, and that's very, very important, because when they start getting confidence in you, they're going to be referring two more patients to you, and that's the best way of getting marketed, in my opinion, other than social media, of course,
Definitely.
because then they're not going to be asking you what are your charges. They'll just say, okay, fine, doctor, just go ahead with the treatment. That's the difference between word of mouth and somebody coming in from Instagram or Facebook, because they already trust you because they've seen your work in somebody else's mouth, and the way they saw it is through the help of pictures. Maybe that would be a better way. So it has a lot of applications, like you name it. Forensic dentistry, forensic odontology has applications. It has applications in oral pathology, even taking pictures of the slides and everything. It's very educational.
Hmm.
So it's got a lot of applications in dentistry, even marketing. So
Correct.
you should start doing photography at the earliest.
Agreed. So now when tell students to start as early as possible in dental colleges itself, third year, what you mentioned. So how should they start? Should they go for any courses? Should they start with their, how is the path that you suggest for them? Because that is the time that they are in general busy, because colleges are going on. You are busy from 9 to 4, 9 to 5. There are preclinicals. There are a lot of things going on. So how do you suggest them to start their journey?
Very honestly, dental photography is not a very major thing to learn, and a couple of days would be just enough to learn the basics.
Okay.
I would actually suggest that they should go ahead with the course, if they want to save time. I mean, if your question is, if you want to learn as early as possible, then join a course. That'll be the best. But if you have time and if you want to explore the field by yourself, there are tons of podcasts. There are tons of articles out there which are going to teach you about dental photography. Follow your inspiration on Instagram. That's Instagram is a very visual medium as compared to Facebook, which has become a mess, I believe. I mean, I personally believe Facebook is a mess, and I spend less and less time every day
Hmm.
on Facebook, and I'm spending more time on Instagram,
Hmm. Hmm.
and now even Clubhouse and other communities on Clubhouse. In fact, just before my interview, I was just talking to someone whom I don't even know on Clubhouse. I just opened a room in the Clubhouse, and there were dentists. It was a dentist club, and people just start talking. So if you have the time, you can explore the field by yourself. There are podcasts, there are articles, there are Clubhouse rooms. Like I have a dental photography school Clubhouse of my own.
Hmm.
They can join in anytime, and if there's somebody, you can start a conversation. But that is if you have time. But if you don't have time, you have courses for it. For example, I do a 3-day course, and I also have an online course. It's like Netflix. You just watch it at your own convenience.
Hmm.
That could actually bring all the content to you in a very concentrated form,
Hmm.
and obviously you've got to pay for it. So if you don't have time, join a course. If you have the time and want to explore it, do it like that. But I would say that concentrated information which is all segregated at one place is going to be more helpful, because it's not only concentrated, it's a step by step thing. That's because one thing after the other.
Hmm.
So it's their choice, however they want to learn, but start learning from first year VDS itself, so that by the time you reach third year, you can actually start taking clinical pictures well.
Great, great. So now, as we are focusing on students,
Mm-hmm.
student life is not, you have very constricted amount of monetary, help and everything,
Mm-hmm.
but the good thing these days is that everybody has, mobile phones, and everybody has basic stuff. So what do you suggest to them? Should you suggest that they should invest in some basic equipments, you know some equipments that you suggest of DSLR cameras and everything, or do you suggest that they can, start with whatever they have and then subsequently build their interest and invest into professional equipments? What is your suggestion for that?
uh, Initially, obviously, if it's a student, I can completely understand that they might have constraints, but I would encourage them to see, very honestly, even if you're a student, you are going to end up buying a good phone.
Yes.
If you have money for a good phone, I'm sure if you have good money to buy
Hmm.
a camera as well.
Hmm.
Because nowadays cameras are also not that expensive. Just
Hmm.
go for any basic DSLR, that's more than enough. A
Okay.
good phone would be like 30,000 rupees.
Correct.
You're going to be using it for how many years? 3 years, tops 5 years.
Hmm.
After that, you're going to throw it.
Yes.
But the DSLR is not like that. Maybe you can convince your parents like that this investment is not only going to be helping you
Hmm.
in in enjoying your life as a photographer, but it's also going to be helping you in dentistry.
Hmm.
Not only that, this investment of 30,000 or 40,000 is going to be lasting you for your life. So I'm not really sure why do people call it expensive, because something that's for 40,000 and it's going to be lasting for your life is not really expensive for me.
Definitely.
So but if you still think that mm, if you still want people to go ahead and use phones, they can. It's not that dental photography cannot be done without a professional camera. It can be done without a professional camera, even with your phone, but obviously the quality is going to be very, very different, right? It's not going to be at par. And I believe that when you cannot see the details, you're not going to be growing as faster or as quicker as a dentist, which you would have
Hmm.
if you would actually invest on a professional camera, which is going to end up giving you very high quality pictures, right? So the choice is yours.
Hmm.
There's no force out there. You can do good clinical photography with your phone, but if you want the best, go ahead for a professional camera. In your first year and second year, you can use your phone, no problem with that. At least try and learn what are the kind of cheek retractors that you can use in your third year. What is a contraster? What is a mirror? There are so many students who don't even know what is a contraster.
Yes. Hmm.
There are so many students who don't even know that 90% of dental photography has to be done indirectly through a mirror. They don't even know that. So by the time you reach the third year, at least clear out these basics, even if it's with your phone. Take pictures of anything, everything. I'm sure you've taken videos in your preclinical days, right?
Hmm.
Very honestly, you are doing dental photography without you giving it a name.
Hmm. Hmm. Hmm.
Yeah.
Yes, I can completely agree.
I remember I was doing dental photography when I was in college, way back in 2006 in oral pathology. I used to take pictures of the slides.
Hmm.
That is what do you call it? That is dental photography. Even if through the microscope also, I've taken pictures of the slide like that only because most of the slide in my college I've not identified through the microscope. I've identified by how the slide looks outside. It's like a more of a spotting thing for me than seeing inside the microscope. So still I'm doing telephotography. If I'm taking a picture of a slide, I'm documenting something important that's going to be giving marks. Even that is dental photography, and I'm sure most of the people who are listening to this have already started dental photography without actually giving it a name. That's what I'm trying to say. But there is a long journey.
Hmm.
If you actually want to record clinical cases nicely, you need to know the step by step technique properly.
Correct, correct. So this is nice to know. So now when you tell the students to actually invest a bit into some of the professional equipments, what are the things that are the must equipments that you can mention that they should have, and 3 4 equipments that you have already mentioned, obviously cheek retractors and contactors, but still a defined list that you can mention.
Mm, very honestly, DSLR camera is the least important thing according to me.
Okay.
What is more important is having a macro lens
Okay.
and a good flash. So go ahead with any basic DSLR camera.
Hmm.
If you're looking for a if you're looking for a model number, it could be Canon 1500D. I'm not that was the latest that is there in that particular range. It's around 30,000, 40,000,
Okay.
or even Canon 800D. But
Hmm.
very expensive cameras are not really that important.
Hmm.
In fact, people actually think the other way. That's ironic. People think that if they buy a good camera, they're going to end up getting good pictures. That's not true.
Okay.
So invest on a basic camera.
Hmm.
That is actually the concept of the reverse concept by that was published by me.
Hmm.
It says that you must invest maximum on the light source,
Hmm.
a medium amount on the lens, and the minimum amount on the camera. However, most of the people actually think the other way around, right? They're like, "Kaun sa camera lu?" It's not like that at all.
Yes. Yes.
Invest on a basic camera, a good macro lens, and a ring flash or a twin flash. Any ring flash or a twin flash.
Hmm. Hmm. Great. Great.
Yeah,
Nice.
but the model numbers are
Yes. Yes. So,
1500D, 800D. These are the cameras. The
okay.
lens that you're looking for is Canon 100 macro lens. When you're buying it, make sure that you're specifying macro quite accurately. That's the most important.
Hmm.
And ring flash or twin flash, you can actually buy any.
Okay. Okay. And any equipments related to dentistry apart from cheek retractors that you will suggest that I.
You need to buy a lot of things actually.
Hmm.
You need to have. See, the problem comes when people start using only one type of cheek retractor for every shot, and that's not going to work. And it's ultimately you're going to end up, causing a lot of inconvenience to your patients,
Hmm.
because such big cheek retractors for every particular use is not recommended. So you need to have two or three different types. You need to have a C shape, V shape, Y shape, a half cheek retractors, at least these. Then you need to have a contraster, which is actually a black background for anti-aesthetic cases. Then you need to have mirrors.
Hmm.
Don't just have one mirror, you need to have mirrors of different shapes.
Okay. Hmm.
Whenever you're planning to buy contrasters or mirrors,
Hmm.
buy rigid ones, buy contra-angled ones, don't buy the straight ones. That's these are some of the tips. You also need to have something called as a gray card. That is actually meant for shade communication. And if you are into indirect restorations and prosthodontics, you need to have a gray card to communicate the colors
Hmm.
very accurately with your lab, the lab that's going to be making the prosthesis or the restoration for you.
Hmm. Hmm. Hmm.
um if you don't want to struggle too much, it's all available in a single box called as the magic box. Maybe somebody can google and they can get their hands on it. Everything is assembled in one box and you can go ahead with that.
Okay. Great.
Hmm.
Great. That's nice to know.
Yeah.
So now, when understanding about all the equipments and how to get started with this,
Hmm.
and so you know just wanted to understand, if a student actually starts with dental photography, the biggest problem that every dentist goes through is कि there it they have a mindset कि इसमें time बहुत लगता है, मैं चालू तो कर दूंगा, but एक patient में if it takes 20 minutes for the whole procedure, it will definitely end up into 30-35 minutes. Is it so, or it's just a myth that every dentist has? What do you suggest?
um See, you don't have to document each and every case meticulously.
Hmm. Okay.
You have to document one particular case meticulously that you're planning to use for publication or accreditation.
Hmm.
Accreditation like AACD accreditation, that's the American Academy of Cosmetic Dentistry. It's basically a club, and
Okay.
if you want to get membership to the club, you need to get accredited. If
Hmm.
you want to get accredited, you have to show the clinical pictures.
Okay. Hmm.
So you've got to take an extra effort to take good pictures.
Okay.
Now, the thing about getting accredited or published is there are a set number of images that you have to shoot. For example, if you're documenting an anti-aesthetic case, there are a set number of 12 images that you need to shoot,
Hmm.
right? So
Hmm.
suppose if there is a case in which I think इसमें result मुझे ज़्यादा अच्छा नहीं मिलने वाला है,
Hmm.
and that it's not a great case for accreditation,
Hmm.
I would just go ahead and record three pictures: one frontal close-up smile, and one lateral, and one intraoral close-up, right?
Hmm.
So that's not going to take much time. In fact, that would hardly take 1 minute or 2 minutes if you actually need, if you actually understand the workflow properly.
Hmm.
But if I'm actually going for accreditation, I think this particular case has a good amount of potential to get published. Obviously, I'm going to be going out of the way. Forget about 20 minutes, 35 minutes, 20 minutes to finish the case, 35 minutes to document. I'm actually going to spend 1 day just documenting everything about that case properly, and not only one set of images. I'm going to be recording 3 sets. Kyuki, if the preoperative is not good, just
Hmm.
say, suppose if the preoperative is not good in one set of images, at least I'm expecting that it'll be better in couple of other pictures. So not only about that, I'm going to be spending 1 day or 2 days just documenting that particular case. It So the bottom line, what I'm trying to say is, you need to filter out your cases, segregate them into what is going to get published, what is going to have you get accreditation,
Hmm.
and some just routine cases that you're just doing for the patient, which might not have a good potential to get published. So you just need to record that particular case, 1 or 2 pictures, and then that should be about it. Now, coming to another point that I'll probably make over here is that you are going to end up taking a lot of time if you don't know how to take pictures. But if you have your workflow very clear,
Hmm.
what do you mean by workflow? The workflow would mean, if you're using a professional camera,
Hmm.
you have camera settings, they have to be right. The lens settings, they have to be right. Flash settings, they have to be right. Which are the interval accessories that you're using? They have to be right.
Hmm.
Where you should stand with respect to the patient, that means the patient dentist position, that has to be right. And most importantly, the composition. What should be seen in that particular picture? Are you able to take it repetitively correct? That is the point. So there is a definite workflow, and if you are good at it, you can do it in a very short time. But if you're just doing it casually without even learning or trying to learn about it, and just randomly shooting pictures, you're going to end up spending a lot more time. That's my opinion.
Okay. Okay. Great. Great. Nice to know about how to.
That's a very good question, actually.
Yes. So now, when understanding about how to take pictures and where how
Hmm.
to filter out patients, the other question is, when you mentioned that you have to do documenting a case for the whole day, how do you convince the patient? So, convincing the patient, a good patient, maybe I have a patient who I know is really good, I have done great work and I want to document that. How to convince the patient to come specially to get documented and to spend so much of time is something which I think is tricky.
So when I actually say documenting for 1 day, means it's like one appointment. It's not like they're sitting in my clinic for the whole day. I
Okay.
would probably want to make that clear. So 1 day means I have one appointment for them of 1 hour for that particular day, and that 1 hour I'm just going to be documenting their pictures.
Okay.
And when it comes to convincing the patient, I don't think it's very difficult. I just tell them that this is how I work, and if you want to get treatment from me, there is no way out. I'm going to be documenting the case thoroughly, and I actually make it very clear that in your case, a very good case, and it's going to help me get an accreditation.
Mm.
You have to get a consent from the patient, and if
Mm.
the patient is understanding, you can go ahead and you know
Mm.
take good pictures. But obviously, consent is the most important, and I believe convincing is not required, because I take pictures for each and every case of mine, irrespective if it's a class 1 cavity in 1/6. I still document it properly. Obviously, the whole series of 12 pictures is not obviously required in that particular case. I'm just taking one picture at different time intervals.
Mm.
One is pre-operative, maybe 6 operative pictures, and one post-operative, and one follow-up picture after 3 days.
Mm.
That's how I record most of my cases. But nothing gets undocumented. Everything is documented. So the people coming to my place, they already know that I'm going to be taking pictures. You need to develop your practice like that.
Mm. Now, one more thing to make it more easier to document. Do you think it is good if you teach this skill to your assistants or help them, take a help of them while taking photographs? What?
Very honestly, if you can do the documentation by yourself, is the best, because you have something in your mind that your assistant is never going to understand verbally what kind of pictures you want, what kind of tooth structure you want in that particular
Mm.
image, how many teeth they want, what should be the angle. It's just too many details to explain to your staff what you want. So I would suggest that you should learn it by yourself. But if you think it's not possible for you, even your staff can do it. And I've actually trained a lot of staff as well. At
Mm.
least I remember I've trained minimum three, not three, maybe five for sure.
Mm.
So the dentist is too busy. So they
Hmm.
have trained their staff, but very honestly, you cannot compare the results. In my it's I mean it's rare. I'm not saying it's not possible, it's rare. I know that there are a couple of staffs which take better pictures than the dentist, because but that is because the dentist does not know at all. It's not the other way around. But I believe that if you're documenting the case, if you're doing a case, you should document it by yourself. If it's a surgical procedure, maybe somebody else can document for you, but even then I would suggest that you can cover your DSLR with a glove,
Hmm.
and then you can still hold your camera with blood in your gloves, because the camera is not going to come in direct contact.
Hmm.
If asepsis is your question.
Hmm.
In fact, there's a video on my YouTube channel. Maybe people should check out Dental Photography School YouTube. There
Hmm.
is a video called "How to Maintain Asepsis in Surgical Cases in Dentistry."
Hmm. Hmm. Nee, that's very important, and surgical cases at times can be difficult to document. Correctly said. So
Hmm.
even if a dentist is documenting a case, do you think assistants do help in in cheek retraction or different ways of making a good angle between this patient and the dentist? What is your suggestion on that?
Yeah, yeah. So I convince my patient to do retraction most of the times, but many a times the retractors do slip off because of saliva.
Hmm.
In that particular situation, and if I feel that it's become a little slow, if the patient is holding it, I do ask my staff to hold the retractors for me. But as soon as they come, I find them as a hindrance. So my staff is quite a hindrance for me. If I'm documenting my case, I would prefer the patient to hold the cheek retractors. Mirrors have to be held by ourselves, and contrasters, if they're contra-angled and rigid, nobody needs to hold it. So that's about me. But obviously, everybody's going to be having different levels of comfort and different levels of staff experience. So if you would want your staff to help you, that's great. If they can help you, that's great. Many times when I'm using a mirror, you require somebody to put a three-way, the air blow through a three-way. Maybe that is something that the staff can do.
Correct, correct. So now, understanding about photography and so many things that you are doing it together. Something that, every dentist, and in fact, I also think is how do you balance it around everything, managing patients, then photography, then, pursuing your hobbies into wildlife and water droplet photography. See, every doctor has a hobby, but there are times that they just give up on that because, we start just focusing on one track. So understanding how do you apart from dental photography, I also want to cover how are you so multi-talented, how do you pursue things in normally.
Um, so my practice is very very different. I do a quality practice, and I take very few patients, because I charge according to that, and I believe in premium services only. I don't have a mass practice, so already because I'm charging premium, my quality is really good, and I use very expensive things for my patients. I already have less flow of patients. But like you said, when you are actually pursuing something else other than your clinical work, it
Correct.
does affect in your clinic as well. Many days in a week, many days in a month, I'm busy lecturing here and there, so obviously it is going to reflect in your clinical practice. But that is for me. um, because I give a lot of lectures across the globe and I'm not available at my clinic, so it does affect my clinic.
Mm,
There is no way that you can escape this, unless you have a good consultant, a good associate working with you. But since my clinic is very small, and my patients want to get treated from me only, it does reflect in the number of patients that I have. So there is no escape, unless you have a good amount of associates or good associates working for you.
mm, mm, mm.
And obviously the kind of lifestyle that I have in dentistry, I believe very few might be having, because I travel a lot and I'm not available for at least 7 days in a month. That's for sure. It does affect my clinical practice a lot. But as a dentist, I don't think others would be doing something like this. I'm sure everybody would be in their clinics for at least so out of 25 or 24 working days, I'm not there for 7 more days or 10 more days. But others might not be like that. So I don't believe dental photography is going to be um, uh, an obstacle for them.
Mm.
But obviously, if you have a hobby and a parallel passion, it's going to be consuming a little bit of from your clinical practice. You've got to be very, very good in time management if you want to balance both of them. But it's very, very tough, according to me. I'm not saying it's impossible, but it's tough. Somewhere down the line, you might want to answer this question: do you want to pursue clinical, or you want to pursue your passion? That question comes and goes. Sometimes you feel you should leave that passion, sometimes you actually feel, should I just leave the clinic and just pursue this? But that question might come. At that point of time, maybe you just need to be a little bit headstrong with whatever you like to do. That question actually came for me as well, way back in 2013, when I was actually spending more energy in trying to encourage people. So I was like, chuck it, man. It's not worth encouraging dentists so much to take up dental photography, because instead of educating them, which was my primary goal, to impart knowledge, I'm actually spreading more awareness, do photography, which is not even worthwhile for me.
Mm.
So I actually gave up in between, and then I came back and I was bouncing back, and it does affect you mentally. You just have to go through it. But it's difficult. It's not easy at all.
Yes, yes, I can completely agree. And that is the reason you're the pioneer behind the dental photography in India, because people actually, when they think about dental photography, it's you who come in their minds. So
Thanks.
great that you have guided so many students out there. So now, understanding about everything, what is it that let's end this on a high note. What keeps you motivated always, and what is it that you want to guide for the students currently who are pursuing their graduation, post graduation, or the fellow dentists? Something that you have learned in your journey, something that motivates you, or anything to keep them positive and motivated in their journey.
Uh, Very honestly, so there's one very addictive thing about dental photography is that if you have done a good case, you should have the best system in the world to document it correctly. Otherwise, there's no point in doing a good case. How are you going to prove to the world that you did a good case? If you want to prove it to the world that you did a good case, you have to document it nicely. And that's what keeps me going. And I believe that's what keeps the other dentists as well keep on going, because they everybody in dentistry wants to improve their work constantly, right? It's dentistry is not like any other field of medicine. Everybody wants to constantly excel themselves, and it's a never ending journey. And there's so much practical work. That is what I wanted to actually put more emphasis on. It's not like other branches of medicine, in the sense you're not just consulting, you are doing physical work. There's a lot of practical work. So if you document nicely, it gives you a buzz. It is like an addiction. And if you're doing good cases, you like to show it off with your colleagues, you want to share it with your patients, you want to share it on social media. That keeps your interest in dentistry alive. So start as soon as possible. In fact, if you're a postgraduate student and if you're listening to this, and if you don't have a DSLR, you're actually doing a crime, because the kind of cases that you might see in your postgraduate life in your colleges might not be available outside when you're pursuing your private practice. So go ahead, get a good camera and start pursuing photography as early as possible, because you have access to so many cases that others might be dying to get, right? Because you have very limited access for those cases in your private practice. You can actually do a lot of skillful work. I would probably want to name it like that. That there are that it's like in the bucket list of many private practitioners, but because they might not be able to do it because it's a private practice, you can still do that in your PG life. So there are a lot of things that are possible in PG life. If you're actually interested, you can do it. Otherwise, it's not going to be happening. But the best buzz that you're going to be getting is delivering the best to your patient and doing difficult cases, something thinking out of the box and being very perfect in your skill, whatever you like. Say even a class 1 restoration, if you're good at giving your tooth a good anatomy, it's going to give you a buzz that's going to be lasting you for your life. And if when you do a good case, you actually want to do the second case even better. That's what keeps all the dentists going every time. And I would say that if you actually want to get that buzz, start doing good photography immediately. As soon as you listen to this particular episode, you need to start reading more about photography, follow more inspiration. Not only in India, there are so many photographers abroad who are doing great cases. The cases are so good. I was like, whoa. I was like, I wish I could have a lab like that. I actually say that I wish I could do a tooth preparation like that. Even after so many years of practice, I feel I still want to learn because I might want to end up doing that kind of a tooth preparation. So that's something that keeps every dentist alive inside. That's the excitement to be better every day. And I'm sure it's there in you as well. But if you want to see that excitement and capture that excitement, hold it in your camera, hold it in your pictures so you can refer to it. Maybe when you retire, you can say, this is the kind of work that I was proud of when I used to do for myself. What keeps me going is dental photography is like the ocean, and every day there are so many new pictures coming in, which is like a source of inspiration. I've got so many friends across the globe now. They're great dental photographers, and the techniques that they use, the passion that they have is like never ending. It gives goosebumps to me as well. Like, wish I could have taken a picture like that. So it's just the passion to deliver, and that keeps me going. And I'm sure that there's a passion lying hidden inside you as well. It just needs to start off somewhere, and I'm sure dental photography is going to be the starting point for you.
That's so inspiring and so nice to know. Me hearing this also is so inspired and so motivated to pursue dental photography. Thank you so much, Dr.
Great.
Mayur, to join us and actually to motivate each and every of our viewer as well as myself to pursue dental photography, something that is now an eminent part of dentistry. You have to understand this, that dental photography is something that you should start learning and implementing. There is no way out of it, as now as social media is a part that we have understood post pandemic. Dental photography is also something that we have to understand now. Thank you.
Even making reels on Instagram is dental photography.
Yes,
You're
yes.
making a video ultimately.
Correct, correct, completely true. So thank you so much, Dr. Mayur Davda, for taking out time for helping us understand about your journey, about things in dental photography, as well as what motivates you to stay on track and to keep on learning. It was so nice understanding each one of this. I myself am so inspired. I'm sure all of our viewers are also motivated and inspired listening to you. Please, if you want to connect with him, as he mentioned, he's available on all the social media platforms and is more active on Instagram. So if you want to connect with him, you can definitely do that. You can see all his old videos also on most of the social media channels, from YouTube to Instagram to to Facebook to Clubhouse, everywhere. As well as you can follow the social doctor also on the Instagram, YouTube, Facebook, where you can also find all our old videos that can also help you in your career growth. Thank you so much, everyone. Thank you so much, Dr. Mayur, for joining us. It was really
My
nice.
pleasure. My pleasure.